Welcome back to another deep dive with us. Today we're going to be taking a look at something called acute kidney injury, AKI.
AKI.
And we have a really interesting script here that is, it's basically a medical script that's going to be used for a video about AKI.
Yeah.
And I have to admit some of the things in here are pretty surprising. But hopefully by the end of this, you'll understand what AKI is and why it matters to you, and maybe even some things that you can do to protect your own kidneys. Now, we're going to be going through the three main types of AKI, prerenal, intrinsic, and postrenal.
Yeah.
So I'm no medical expert, but thankfully we have someone here with us who is.
Yeah.
So let's dive in.
So AKI is really just a sudden decline in your kidney function. And we all know kidneys, they filter waste products from the blood, but it's also really fascinating that they help maintain that very delicate balance of fluids and electrolytes in your body.
Right. And one thing that this script mentioned that I thought was interesting was that
Yeah.
AKI is often reversible if caught early enough.
Absolutely. Early diagnosis and treatment are so important. So to understand those three types that we talked about, the prerenal, intrinsic, and postrenal, think about it this way. Prerenal AKI happens when there's just not enough blood flow to the kidneys. Intrinsic AKI means there's damage within the kidney itself, so it's really impacting its ability to filter. And then finally, postrenal AKI arises from a blockage in the urinary tract, almost like a dammed up river.
Oh, okay, that makes a lot more sense. So what kinds of things can trigger these different types of AKI?
Well, the causes can be pretty diverse. Prerenal AKI can be triggered by anything that drastically reduces that blood flow to the kidneys. Severe dehydration, heart failure, or even a major allergic reaction that leads to shock.
Wow. So even like getting severely dehydrated after like running a marathon or something like that could lead to AKI. That's kind of alarming.
Yeah, it's a good example of how, our everyday activities can have some consequences for our kidneys that we might not even realize. Now, intrinsic AKI, we're often looking at direct damage to the kidney tissue itself. This could be from infections, certain medications like some antibiotics or NSAID painkillers if they're overused, autoimmune diseases, or even exposure to certain toxins.
Okay, so those seemingly harmless over-the-counter painkillers that we just pop for like headaches and things could actually be damaging our kidneys if we're not careful.
That's right. And it's always important to, follow the dosage guidelines and talk to your doctor about potential interactions, especially if you're taking multiple medications.
Yeah. And I noticed in the script it even mentioned contrast dye.
Yeah.
That's used for, imaging and things like that.
Yeah, that's a good point. Contrast dye is generally safe, but it can be a little bit risky for those with pre-existing kidney problems. So doctors are usually very cautious about using it in those situations. And, they take steps to try to minimize any potential damage.
Okay, so with all these potential causes kind of lurking about, what are the signs that our kidneys might be in trouble?
Well, that's where things can get tricky, because AKI can be a bit of a silent culprit. Sometimes there are noticeable symptoms, but often, especially in those early stages, there are no clear warning signs.
That's concerning. The script did mention some symptoms like, decreased urine output and swelling. What are some other things that people should look out for?
Right, reduced urine output. Sometimes to the point of barely urinating at all, that's definitely a red flag. The swelling, typically in the legs, ankles, or even around the eyes, that's from fluid buildup because the kidneys aren't filtering properly. And then you might also experience fatigue, nausea, vomiting, and even confusion or difficulty concentrating.
It seems like some of these symptoms could easily be mistaken for other things. So how do doctors actually diagnose AKI, especially, since it's not always so obvious?
Blood and urine tests are crucial for detecting AKI. And specifically, they're looking at creatinine and BUN levels in your blood. These are waste products that your kidneys normally filter out. And if those levels are high, it's a sign that your kidneys aren't functioning as they should.
Could you explain a little bit more about creatinine and BUN levels? What should people kind of know about those?
So creatinine is a byproduct of muscle breakdown, and BUN stands for blood urea nitrogen, which comes from protein breakdown. So typically, creatinine levels should be below 1.2 milligrams per deciliter for men and below 1.0 milligrams per deciliter for women. BUN levels usually fall between 7 and 20 milligrams per deciliter. But if these values are significantly higher, that could indicate AKI.
Okay, so those are the numbers to kind of keep an eye on. It seems like early detection is so important.
It really is. It's much easier to reverse AKI and prevent long-term damage if it's caught early. Doctors will also monitor your urine output really closely because that's a direct indicator of how well your kidneys are functioning. Less urine often means the kidneys aren't doing their job.
Yeah, that makes sense. I remember in the medical video script, they had a picture
Mm.
of a patient in a hospital bed, and they looked really uncomfortable.
Mm.
Are there imaging tests that doctors use to diagnose AKI as well?
Yeah, there are imaging tests like ultrasounds or CT scans, and those can be helpful for identifying any obstructions in the urinary tract, like kidney stones or tumors. That might be causing postrenal AKI. And they can also reveal any structural abnormalities or damage within the kidneys themselves.
So it's like putting the pieces of the puzzle together. Blood tests, urine tests, and sometimes imaging tests to kind of get that full picture.
Exactly. The goal is to pinpoint the root cause of the AKI, which then guides the treatment strategy. And speaking of treatment, there's good news on that front.
Ah, good news is always welcome. Tell me more.
The good news is we have effective treatments for AKI, and they often work remarkably well. The focus is on addressing the underlying cause and supporting the kidneys while they recover.
So walk me through some of those treatment options. What does that support look like?
Okay, so for prerenal AKI, restoring blood flow to the kidneys is paramount. This often involves IV fluids to rehydrate the patient and medications to raise blood pressure if it's too low.
That makes sense. What about intrinsic AKI, where the damage is within the kidney itself?
For intrinsic AKI, treatment really depends on what's causing that damage. If it's an infection, antibiotics are key. If certain medications are the culprit, those might be adjusted or stopped altogether, and sometimes corticosteroids are used to reduce inflammation within the kidneys.
Okay. And what about those cases where there's an obstruction that's blocking that urine flow?
Ah, yes, postrenal AKI. In those situations, the focus is on relieving that obstruction. This might involve medications to help pass a kidney stone, or in some cases, a procedure to remove the blockage, like surgery or inserting a catheter.
Hmm. And the script also mentioned dialysis as kind of a last resort. Can you explain what that is and when it might be necessary?
Sure. Dialysis essentially does the job of your kidneys when they can't do it themselves. It's a procedure that filters your blood externally, removing waste products and excess fluid. Dialysis is typically used in more severe cases of AKI, where the kidneys are failing to function adequately, and it can really be a lifesaver.
Okay, so it's like giving your kidneys a break while they hopefully recover. But what happens if AKI goes untreated?
That's where things can get a little scary. The script showed an image of a patient struggling to breathe, and I thought that was such a powerful reminder of how serious untreated AKI can be.
Yeah, those images are in there for a reason. The script definitely didn't sugarcoat it.
Mm-hmm.
So what are some of the potential complications if AKI isn't caught and treated promptly?
Well, untreated AKI can lead to a cascade of problems. Fluid can build up in your body, causing swelling and difficulty breathing. Electrolytes, those crucial minerals that are in your blood, can get out of whack, leading to things like heart rhythm problems and other complications. And perhaps most worrisome, untreated AKI can progress to chronic kidney disease, which is a long-term condition that often requires dialysis or even a kidney transplant.
That's a scary thought. It makes you realize just how vital those kidneys are. But thankfully, the script emphasized that prompt treatment can significantly reduce the risk of permanent kidney damage.
That's a key takeaway. The sooner AKI is detected and treated, the better the chances of a full recovery. But what's even better than treating AKI is preventing it in the first place.
That's so true. Let's talk about prevention. What are some things that people can do to protect their kidneys?
Fortunately, many of the preventative measures are surprisingly simple. Staying hydrated is absolutely essential. Aim to drink plenty of water throughout the day, especially if you're active or out in hot weather. And be mindful of those over-the-counter painkillers, the NSAIDs we talked about earlier. Use them only when necessary and follow dosage guidelines very carefully.
Right, no more popping ibuprofen like candy. So what else can we do?
Managing any chronic conditions that you have, such as diabetes or high blood pressure, is crucial because these conditions can put extra stress on your kidneys, so keeping them under control is key. And of course, good hygiene practices to prevent infections are always important. Simple things like washing your hands frequently and practicing safe sex can go a long way in protecting your kidneys.
Yeah, I feel like we often take our kidneys for granted. It's easy to forget how hard they work to keep us healthy.
It's true, they are the silent workhorses of our bodies filtering our blood around the clock. So here's a question for you. Do you think we as a society do enough to promote kidney health?
That's a really good question. I'm not sure I have a good answer. We talk a lot about heart health and staying active and things like that, but I don't hear as much emphasis on kidney health.
Exactly. And it's not just about individual choices. Things like access to clean water, affordable health care, and even exposure to environmental toxins can all impact kidney health.
That's an excellent point. It's a reminder that health is so interconnected with, larger societal factors.
Absolutely. And it brings us right back to that importance of awareness. Even though we've covered a lot of ground today about AKI, there's still so much more to learn and explore.
And that's why we love these deep dives. It's all about piquing our curiosity and encouraging us to delve deeper into these topics that impact our lives.
Precisely. Now I'm curious to know what stood out to you the most from our deep dive into AKI today. What really resonated with you?
For me, it's the realization that AKI can be silent, lurking beneath the surface without any obvious symptoms. It makes those blood tests and regular checkups seem even more important, especially for those who might be at higher risk.
That's a really crucial point. Early detection through, regular checkups and blood work can really make all the difference. It's like catching a small leak in a pipe before it turns into a major flood.
Right. And knowing that simple things like staying hydrated and
Yeah.
being mindful of over-the-counter medications can have such a big impact. That's empowering.
Absolutely. Knowledge is power. And speaking of knowledge, while we've covered the basics of AKI, there's a whole world of, ongoing research and advancements.
In treatment and prevention.
Like what?
Yeah.
What are some areas of AKI research that you find particularly interesting?
Well, one area that I find fascinating is the development of biomarkers that can actually predict AKI even earlier than traditional blood tests. So these biomarkers could potentially identify those at risk before any noticeable case. That would be incredible, especially for people who might be at higher risk due to pre-existing conditions or certain medications.
Exactly. And there's also a lot of research focused on personalized medicine for AKI, which involves tailoring treatments to an individual's specific genetic makeup and other factors to really optimize their recovery and minimize the risk of complications.
So it seems like the future of AKI treatment is heading towards this more personalized and preventative approach.
Definitely. And it makes you wonder, what else could be done, perhaps on a larger scale, to better support kidney health and reduce the incidence of AKI? We talked about those societal factors earlier. Do you have any thoughts on that?
Well, it seems like raising awareness about AKI is crucial. A lot of people don't even know what it is or that they might be at risk. So public health campaigns could play a big role in educating people about the importance of kidney health and early detection.
I agree. Public awareness is key. And perhaps there could be more initiatives that are focused on those preventative measures at the community level, like promoting hydration, healthy diets, and responsible use of over-the-counter medications.
Those are all great ideas. It seems like we've only scratched the surface of this topic.
We have, but I think we've given our listeners a really good foundation to build upon. They now understand what AKI is, what can cause it, how it's diagnosed and treated, and most importantly, the steps they can take to protect their own kidney health.
And hopefully they've also been inspired to learn more and perhaps even become advocates for better kidney health in their own communities.
That would be fantastic. Imagine the impact we could have if everyone took a proactive approach to kidney health.
Well, that wraps up our deep dive into acute kidney injury. We hope you found it informative, thought-provoking, and maybe even a little bit inspiring.
Remember, your kidneys are essential organs that work tirelessly to keep you healthy. Treat them well, and they'll reward you with a lifetime of good health.
Thanks for joining us on this journey of discovery. We'll be back next time with another deep dive into a topic that matters to you. Until then, keep those brains curious and stay well.